The improvement in health quality of the population is a continuing challenge for society and governments. In spite of many advances in medical practice and health sciences in the past years, the vast majority of the population is still barely meet the minimum standards for healthcare and human development. Faced with the inadequacy in health services, the emergence of lifestyle diseases, new and uncontrolled communicable diseases, maldistribution of health resources, and the worsening social and economic status of the marginalized, and some societies and governments are not able to cope adequately to meet the needs of the population. In the age of globalization, health and health problems too have become global. Cardiovascular diseases and cancer are no longer identified as diseases of just affluent countries. Even developing countries like the Philippines are seeing a continuous upward trend of these diseases in the past decade. Note that healthcare is not just a problem of poor developing countries, even the wealthiest countries are facing healthcare concerns. These countries are now coping with the situation where they have an aging population with chronic illnesses that need long-term care. Hence, an overall approach in the delivery of health services is necessary, a strategy that engages both the health workers and the people themselves as partners, and a strategy that is affordable to the government yet is still effective and acceptable to the communities. A strategy that ensures access to health care regardless of economic class. The World Health Organization, or WHO, has long championed a strategy that it believes is the key to the most health problems, and for more than 30 years, the World Health Organization has not wavered in its promotion for the global implementation of primary health care. On September 6 to 12, 1978, health leaders from around 200 countries attended the International Conference for Primary Health Care held at Alma-Ata, USSR, initiated by the World Health Organization and United Nations Children's Fund. Together, they expressed the need for concerted effort by all governments and health and development workers for the protection and promotion of health of all the people. The Alma-Ata Declaration on Primary Health Care emerged from this conference. The Alma-Ata Conference made the following declarations: health is a basic fundamental right. There exists global burden and health inequalities among populations. Economic and social development is of basic importance for the full attainment of health for all. Governments have a responsibility for the health of their people. The primary health care strategy was later adopted in the Philippines by virtue of Letter of Instructions 949 of 1979, making the Philippines the first country in Asia to embark on meeting the challenge of PHC. It must be noted that even prior to LOI 949, which provided impetus to the Ministry of Health, there were several health workers, non-government organizations, and church organizations offering community-based health programs in the rural areas of Visayas and Mindanao, applying the spirit of PHC even before it was formally adopted by the government. Basic to the PHC Declaration is a common view that health is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity, according to the World Health Organization of 1978. Viewing health from a holistic perspective beyond just physical and mental maladies, the World Health Organization has put equal emphasis on the social dimensions of health, that wellness can be achieved by considering different factors that interdependently influence the health of the population, such as the environment, education, social services, and politics or leadership. In addition, health is seen as not just a product of social and economic development, but more so as a means of achieving development. Thus, government investment in the health of the population is ultimately linked to the country's development. A healthy population has the capability to contribute more to its development. By emphasizing the people's right to health, the government is driven to increase investment on health care. The World Health Organization recommends government to allocate 5% of the gross national product to health services in the Philippines. The average allocation for health services from 2005 to 2007 was only 3.3% of the gross national product. According to the Alma-Ata Declaration, primary health care is essential health care based on practical, scientifically sound, and socially acceptable methods and technology made universally accessible to individuals and families in the community through their full participation and at a cost that the community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. The universal goal of primary health care, as stated in the Alma-Ata Declaration, is health for all. By the year 2000, health for all means an acceptable level of health for all the people of the world through community and individual self-reliance. This policy agenda of health for all by the year 2000 technically was a global strategy employed for achieving three main objectives. First, promotion of healthy lifestyles. Second, prevention of diseases. And third, therapy for existing conditions. Although many states have adopted the plan and have made significant progress in achieving these objectives, the challenge rests among nations, developed or developing alike, and a considerable amount of work remains to be done to achieve the aims of the declaration. To put further emphasis on primary health care in the Philippines, President Ferdinand Marcos signed the LOI 949 that has an underlying theme, Health in the Hands of the People, by 2020. The World Health Organization has identified five key elements to achieving the goal of health for all. First, reducing exclusion and social disparities in health, universal coverage. Organizing health services around people's needs and expectations, or health service reforms. Integrating health into all sectors, public policy reforms. Pursuing collaborative models of policy dialogues or leadership reforms and increasing stakeholders' participation. The Alma-Ata Declaration listed 8 essential health services using the acronym ELEMENTS as a memory aid. E stands for Education for Health, L. Locally Endemic Disease Control, E. Expanded Program for Immunization, M. Maternal and Child Health including Responsible Parenthood, E. Essential Drugs, N. Nutrition, T. Treatment of communicable and non-communicable diseases, S. Safe water and sanitation. The key principles that set primary health care apart from the traditional mode of healthcare delivery are accessibility, affordability, acceptability and availability, support mechanisms, multi-sectoral approach, community participation, equitable distribution of health resources, and appropriate technology. The 4 A's of primary health care: accessibility, affordability, acceptability, and availability. Accessibility usually refers to the physical distance of a health facility or the travel time required for people to get the needed or desired health services. This requires the existence of a facility within reasonable distance from the catchment population or the people it is meant to serve. The World Health Organization guideline states that for these healthcare facilities to be considered accessible, they must be within 30 minutes from the communities. Barangay health stations are facilities intended to provide accessible health services at the community level. Affordability is not only in consideration of the individual or family's capacity to pay for basic health services. Particularly for public health services, it is also a matter of whether the community or government can afford these services. One of the factors the World Health Organization consider is determining affordability of healthcare is the out-of-pocket expenses for healthcare. This is the actual cost to the family for health services less any coverage of insurance. In the Philippines, the government health insurance is covered through PhilHealth. There are other health insurance policies offered by private companies or health management organizations. Acceptability means the health care offered is in consonance with the prevailing culture and traditions of the population. Availability is a question of whether the basic health services required by the people are offered in the health care facilities or is provided on a regular or organized manner. Consider the following health programs and analyze them according to the 4 A's as defined above. Botika ng Bayan and Botika ng Barangay. These drugstores were established in the Philippine government to promote equity in health by ensuring the availability and accessibility of affordable, safe, and effective quality essential drugs to all, with priority given to the marginalized, underserved, critical, and hard-to-reach areas. These government-run drugstores distribute, sell, or make available low-priced generic home remedies, over-the-counter drugs, and selected publicly known prescription antibiotic drugs. DOH Administrative Order 23A of 1996. It must also be noted that some botika ng barangay stores are operated by non-government institutions, church, and cooperatives. Second, ligtas sa tigdas ang Pilipinas. Mass Measles Immunization Campaign. Children aged 9 months to below 8 years old were vaccinated against measles and rubella. In addition to a door-to-door campaign, the immunization is also offered in all health centers, BHS, hospitals, and other temporary immunization sites such as basketball courts, town plazas, and other identified public places during the campaign. Support mechanisms. The resources for essential health services come from three major entities: the people themselves, the government, and the private sector like NGOs and socio-civic and faith groups. Health programs and projects provide better outputs when these three entities are involved. For efficient utilization of resources from these three major sectors, a multi-sectoral approach is necessary. Multi-sectoral approach. As health and disease are outcomes of multiple interrelated factors, primary health care requires communication, cooperation, and collaboration within and among various sectors. This is exemplified through intrasectoral and intersectoral linkages. Intrasectoral linkages refers to communication, cooperation, and collaboration within the health sector, among the members of the health team, and among health agencies. This is exemplified by the team approach utilized by the personnel of a health center in dealing with health conditions and problems. The two-way referral system, another illustration of intrasectoral linkages, is necessary so that clients get the needed and desired care. For example, a pregnant woman who had prenatal checkups in the BHS or Rural Health Unit has been identified as high risk. She would be referred to the appropriate hospital for childbirth. In this case, competent care is ensured and available health resources are utilized properly. In the spirit of the two-way referral system, the same mother once discharged from the hospital is referred back to the RHU for follow-up home care, a service that most hospitals obviously do not provide. Hence, given the above scenario, the two-way referral system ensures competent care, maximum use of availability of resources, and continuity of care. Intersectoral linkages. One of the major criticisms against the traditional perspective in development is that the tool for analysis and strategies used are primarily economic in orientation. The idea that the population is sick because they are poor implies that illness or health is a result of economic gains or the lack thereof. Primary health care seeks to reverse this paradigm, advocating a more comprehensive view of the synergy between health and economic development. Simply put, health is not merely the product of the economic development. Health and economic development complement each other in the achievement of this societal goal of holistic human development. Health is a multisectoral concern. Therefore, primary health and public health programs should not and cannot be taken in isolation from the overall development agenda of society. Intersectoral linkages encompass the communication, cooperation, and collaboration between the health sector and other sectors of society like education, public works, agriculture, and local government officials. A concrete example of intersectoral linkages is the Rabies Prevention and Control Program. It requires collaborative effort among the Department of Health, Department of Agriculture, Department of Education, and local government units. The DOH provides immunization for victims of animal bites. The DA provides outreach rabies immunization for dogs, while the DepEd and the LGUs are in charge for information campaign in school and communities. Community participation. A key to understanding the concept of primary health care puts emphasis on how it is defined, that health is achieved through self-reliance and self-determination, and that individuals, families, and communities are not considered as recipients of care but active participants in achieving their health goals. Community participation is an educational and empowering process in which people, in partnership with those who are able to assist them, identify their problems and the needs, and increasingly assume responsibilities themselves to plan, manage, control, and assess the collective actions that are proved necessary. Ideally, true or active participation means that people should be knowledgeable about their own health problems and should identify the needs for their solution or reduction and draw out plans of action according to the priority and the resources available, organize and implement the programs, and monitor and control their progress, and periodically evaluate for getting the feedback and do the reprogramming. Equitable distribution of health resources. Primary healthcare advocates for care that is community based and preventive in orientation. It calls for an inventory and analysis of health resources, facilities, and manpower. According to the Health Manpower Development and Training Services, the Philippines has an oversupply of graduates of medicine and nursing, but they tend to flock to the urban rather than to the rural areas. Among health professionals employed by the Philippine government, around 29% and 26% of doctors and nurses, respectively, practice in the National Capital Region and Calabarzon. This is also a general impression that graduates of health-related college programs prefer to work abroad rather than to stay in the Philippines. To reverse this trend, the DOH is spearheading two programs to ensure equitable distribution of manpower to the rural areas. These programs are Doctor to the Barrios program. The DTTB program is the deployment of doctors to municipalities that are without doctors. DTTB volunteers are fielded to manage the RHU or health centers in unserved, economically depressed fifth or sixth class municipalities for 2 years. They also have the option of being permanently absorbed by the municipality. These volunteers are offered competitive compensation by the DOH and the LGU. Registered Nurses Health Enhancement and Local Services or RN-HILS. The RN-HILS is a training and deployment program for unemployed nurses. RN-HILS volunteers are deployed to unserved, economically depressed municipalities for 1 year to address the inadequate nursing workforce in the rural communities and health facilities. It also provides the nurses valuable training to enhance both their clinical and preventive management competencies. Compensation for the volunteer nurses are also shared by the DOH and the LGU. Appropriate technology. According to the dictionary, technology is applied science. Health technology includes tools, drugs, methods, procedures, and techniques. Appropriate technology refers to the technology that is suitable to the community that will use it. To better capture its essence, the terms people's technology and indigenous technology are also used in reference to appropriate technology. Criteria for appropriate health technology. Safety. This means that the technology results in minimal risk to the user and that the intended positive outcomes of the use of a technology far outweigh its unintended negative effects. For example, the pertussis vaccine. It is a component of DPT which is administered in the expanded program on immunization. It is not recommended to be given to a child who is 7 years old or older because at this age the vaccine is already more hazardous than the disease itself. Effectiveness. The technology should accomplish what it is meant to accomplish. For example, medicinal herbs endorsed by the DOH have been tested and have been clinically proven to have medicinal value in the relief and treatment of ailments. Affordability. Measures for health promotion and disease prevention at cost effective in comparison to treatment of disease. Prevalent childhood conditions such as cough and colds, diarrhea, and fever often require home management only. This cost-effective intervention requires an educated community. Simplicity. The technology that requires readily available, simple materials and that involves a simpler process in its use can be more easily adopted by the people in the community when and where applicable. For example, oral rehydration for management of diarrhea is a simple technology that can be administered at home. Acceptability. Technology is effective only when it is used by those who need it. Thus, culture is an important consideration in determining an appropriateness of a technology. In addition, education regarding a particular technology is essential for its adoption. Feasibility and reliability. The technology must be easy to apply considering the people's natural settings like the home, school, workplace, and community. Supplies must be constantly available. For example, compared to the chest x-ray, sputum examination is feasible in more areas. Ecological effects. Effects on ecology are important consideration in choosing or rejecting a particular technology. For example, DOH Administrative Order Number 21 Series of 2008 mandated the gradual phase out of mercury in the Philippines healthcare facility and institutions. Potential to contribute to individual and community development. Appropriate technology promotes self-sufficiency on the part of those using it. PHC is a strategy for the delivery of health programs. It should not be confused with primary care. According to the American Association of Family Medicine, primary care includes health promotion, disease prevention, health maintenance, counseling, patient education, and diagnosis and treatment of acute and chronic illnesses in a variety of healthcare settings. Primary care is performed and managed by a personal physician, often collaborating with other health professionals and utilizing consultations or referral as appropriate. It refers to the first contact of a person with a health professional specifically trained for and skilled in comprehensive and continuing care for person. Furthermore, PHC should not be confused with primary nursing, whereas PHC is a strategy for healthcare delivery focusing on the community, family, and individuals Primary nursing is a model of nursing care that emphasizes continuity of care by having one nurse providing complete care for a small group of inpatients within a nursing unit of a hospital. Nursing care is directed towards meeting all of the individualized patient needs. Primary health care is a philosophy and a strategy. It is not one single program or project, rather it is the overarching strategy for the whole public health program. All DOH programs are anchored on the key principles of primary health care. These programs seek to correct the inequities in health, ensuring health care for the most vulnerable population group in the country. For these programs to be effective and sustainable, this required genuine partnership of different sectors, government and private sectors. And more importantly, these PHC programs should be a partnership between the healthcare providers and the community, and by so doing, these programs fulfill the vision of making all essential health services accessible, affordable, available, and acceptable, therefore achieving our goal of health is for all.